Next in the ABCDE assessment, after we've done airway and breathing, comes circulation. And here we want to make sure that the heart rate and the blood pressure are optimised for transport. Again, what we don't want to be doing is having to give rapid fluid boluses or setting up new infusions or finding that we haven't brought an infusion for somebody who needs blood pressure support during transportation. Heart rate can be assessed obviously by feeling the pulse or using an ECG. And for this, what we want to make sure is that the patient isn't overly tachycardic or bradycardic. And we can correct this as well by using things like atropine to bring the heart rate up if they're bradycardic. But also don't forget, if your heart rate is high, it might be related to pain, and we might need to give analgesia as well. And this can happen during transport as well. If we're thinking about those forces of vibration on somebody who's maybe got a pelvic fracture, we might have a high heart rate because of the pain that they're experiencing during transportation. Blood pressure can be optimized if it's hypotension through fluid boluses, but can also be optimized through starting infusions in the hospital or anticipating that we might need them. And also we should make sure that any hemorrhage is controlled, which is going to impede on the blood pressure further. Also, before we leave the hospital or the site, we need to make sure that we've got control of any obvious hemorrhage. And this is important to also check the patient's back and also check the patient's sheets to see if they've got any blood or visible blood. And this is important to control them either surgically before we move or through applying pressure or a tourniquet. We also need to make sure, in relation to the blood pressure and heart rate, that we restore any blood volume that's been lost before we leave. The patients who's had a massive hemorrhage will typically have a high heart rate and a low blood pressure. And this relates back to making sure that we have the heart rate and the BP optimized. In these patients, we may need to actually give them red blood cell transfusion before transportation, and we may need to get fluids on the go as well in the hospital in order to optimize that. And this goes nicely on to the next point, that it's always a good idea to have two routes of IV access, two wide bore cannulas, because what you can find is that if you've got an infusion running, you may need to start another one during transit, you may need to give some blood, you may need to give some fluids, and it's a lot easier to have two separate cannulas. And don't forget as well, when you're giving blood, you can't actually administer anything else through this line until the blood's gone. Therefore, two cannulas is a good idea. Also, we have to think about how closely we want to monitor things in the hospital, but also during transport. And for this reason, we sometimes insert an arterial line, which either goes into the radial or the brachial artery. What this allows us to do is actually get a beat-to-beat measurement of the blood pressure that will change in real time, as opposed to using a non-invasive blood pressure cuff. Non-invasive blood pressure cuffs are good for short transportations, but the problem is if you're moving your patient and repatriating them, having a blood pressure cuff go up every 5 minutes is probably quite uncomfortable, and for that reason we sometimes opt for an arterial line to monitor the blood pressure. Also, we need to consider if we have to get central venous access, and this is usually a line that's inserted into the internal jugular in the neck. This gives us the ability to give fluids rapidly, and it also gives us the ability to use stronger drugs to manage the blood pressure, such as noradrenaline or adrenaline, and these are typically attached into the central venous axis. These sometimes come in either 3, 4 or 5 lumens, so you can end up with a patient that you've actually got 6 points of IV access while you're transporting them, which enables us to connect various fluids or drugs to support the circulatory system.